What you're doing here is harnessing the body's need to heal and repair itself. We're not inventing anything new. We're simply taking all these bioactive signals from a 20-year-old female and putting them in a product that when we apply it to our skin, we can have some of the healing and regenerative powers of a young woman. It's really the new frontier of regenerative medicine. The ANTEAGE product has taken the stem cells of 20-year-old women and has extracted the cytokines, which are the proteins that the stem cells make. In addition, why not add all the classical ingredients that we know help our skin, such as antioxidants with the various vitamins such as retinol, ceramides, and different peptides. And so when you put this all together in a product, you have everything that you really need.
We use cytokines and growth factors that are secreted by young, healthy mesenchymal stromal cells. And then we feed them to aging cells in the skin, for instance. Basically, by feeding the aging cell cytokines and growth factors from young, healthy cells, what we do is we make them believe that they are young again. I mostly work in the lab, and I grow the stem cells, and I plate them, I feed them, and I make sure that they are happy and healthy and that they duplicate.
Just wanted to show you briefly our human cell biology lab. This is actually our research lab, and in this room is actually our highest level clean room. It's a class 7 ISO GMP certified, so this is the kind of lab you need to make FDA approved injectable pharmaceutical grade biologicals. Now, of course, the products that we make for the current ANTEAGE range are topical and they're not drugs, but this is the kind of facility that we need for what we have planned in the future. So we're doing a lot of exosome R&D in here, as well as testing and assays on our current products, classifying exactly the proteins, the cytokines, the growth factors that are in our products to make sure that what goes on to people's skin is exactly what we expect it to be, what we want it to be, and that it's manufactured to the highest standard.
Microneedling is unlike any other advanced modality that destroys or disrupts the skin's barrier in any way. While most lasers or other modalities that burn through the barrier actually stimulate a significant amount of inflammation, microneedling, on the other hand, mitigates any excess inflammatory cascade while tapping into your skin's regenerative capacity. Microneedling on its own, while a fantastic modality, is a small portion of the puzzle. To really maximize and optimize the performance of your needling session, you really need and want to combine it with the right topical nutritional tools to really flood the skin with additional protein molecules to heal that skin unlike any other topically applied product in the post-procedure scenario.
We're going to present now a kind of a novel system that we have done clinical studies, and we're having good successes around the world with hair restoration.
A patient will come in and we'll numb them topically for about 20 to 30 minutes. After they're numb, we clean off the numbing and we apply the microneedling solution, and then we'll microneedle them. The procedure is fairly quick, about 10 minutes. Currently, the feedback that we're getting from participants is less hair loss and fuller and thicker hair.
To really optimize the results of any in-clinic follicular regeneration protocol, it's really vital that clients and patients use topically applied daily solutions to really allow that scalp to be saturated with all of those additional protein molecules on a continuous basis. We created the ANTEAGE hair system for those clients to use every single day at home to augment and support the results they're getting in clinic.
Our flagship system is actually two parts. It's the Serum and the Accelerator, because we want to be able to offer someone a complete anti-aging system in 2 steps, whereas other lines you might have to do A, B, C, D, E, all these different serums. We've packed it all into 2 parts. So there's 18 active ingredients in here, including niacinamide, vitamin E, vitamin C, bakuchiol, which is a non-irritating retinol alternative, in addition to, of course, our hero, which is the stem cell-derived growth factor and cytokines.
Now these cytokines, they will go to a cell in your skin. This will turn on that cell. And these cells, it's called a paracrine effect, will start making their own cytokines as well. So you start to get a snowballing effect that you are now making more of the substances that you require to heal and regenerate your skin. You're doing it yourself. So the more you do this, you get an avalanche effect.
Well, I've tried a lot of products in the past, and so really my expectations were quite low. You know, if it would moisturize, great. If it would maybe take some spots away, great. But the results that I got with ANTEAGE were far and above my expectations.
One of the best compliments that I've had, I ran into somebody that I haven't seen in a couple of months, just yesterday in fact, and he said, wow, you know, you always look nice, but there's something about you now that's different. Wow, you look really beautiful. And it was just completely out of the blue, and I thought, wow, now that tells me something is happening.
It feels so good. It feels like my skin is breathing, which I've never experienced before. The creams that I've used, and I have tried some high-end stuff, nothing quite like it. It just really works, and my skin feels alive.
I was having some cocktails with friends of mine a couple evenings ago, and they didn't know about the trial that we were doing. This woman hadn't been aware of it, and she was like, what have you been doing? Your skin looks phenomenal.